Hello, my name is Mona Despani, student nurse, and I'm going to be doing checkoff on catheterization and cath care on the male. First of all, introduce myself, Mona Despani, identify my patient by their name, date of birth, or check in their band uh, if they're in the hospital. First of all, I'm going to check my physician's orders compared to my MARS to make sure that everything matches according to the orders in the MARS, what needs to be done for the patient. Next, I'm going to explain everything to the patient, letting him know that I'm going to be inserting an indwelling catheter and doing catheter care as per the doctor's orders. And during that time, I'm going to ask for him to lay down in supine position. And as I'm doing the procedure, to tell him to relax and take some slow, deep breaths as I'm inserting the catheter. First of all, I'm going to wash my hands thoroughly, and then I'm going to apply clean gloves. I already have my supplies readily available. Patient is draped. Now I'm going to open the sterile field, making sure to maintain sterile field, starting on the far end away from me. I'm going to take out the drape. This is going to go under the patient. And this is for the female, but I'm doing the male. Now I'm going to remove my clean gloves, gel, or wash my hands again, and now I'm going to get out the sterile gloves. As I take out the sterile gloves, I'm going to open it, maintaining sterility, not going below the tape area to remove the gloves out. And simulate applying the sterile gloves. And pinch it. And then I'm going to start with my dominant hand by catching it under here, and it's applying the right hand, dominant hand first, and then once I have the dominant hand first, next I'm going to put the non-dominant hand on, and then I'm going to get my supplies, still having sterile gloves on. I'm going to get the supplies prepared. I have my alcohol swab. I have my syringe to connect to the Foley catheter. And I'm going to get out the catheter. And you already have a protective lining on it. During that time, I'm going to hook up the syringe to the catheter. And open up the alcohol swabs. And putting it into the container. I'm dropping it. Taking the catheter out, removing this, keeping everything in sterile field. In sterile field, and I have my gel. I'm going to coat the catheter with gel. Open the gel, insert it in the catheter, in the tray, and I'm going to coat the catheter. And now my hand is still sterile until I touch the male's penis. Now I'm going to coat this catheter with gel, maintaining sterile feel. Everything's still in the sterile feel. And now since I'm going to be using this hand, I'm going to use just this hand to insert the catheter while I hold the penis to insert the catheter. And while I'm inserting the catheter, I'm telling the client to relax and take deep breaths as I insert the catheter in a circular motion, in circular motion, in circular motion, until I feel the bifurcate of the male, until I feel the bifurcate of the male, and then I'm going to get the syringe and inflate the balloon, making sure that I inflate the balloon. And as I'm inflating the balloon, inflating it, and then I'm going to pull back to make sure that it's in place. And then I'm going to take the syringe off and make sure that the urine is flowing without any problems. And then I'm going to tape the catheter to the side of his thigh to make sure it doesn't come out, and make sure that I put the catheter where the urine can drain, and the urine is draining clear, nice clear yellow urine. And then I'm going to remove all the supplies, dispose of it in the biohazard bag in the garbage container. And I'm going to remove my gloves, wash my hands, apply gloves, and I'm going to do catheter care around the meatus of the penis in circular motion on each side. Another side. And then I'm going to come back and dry the area with a dry gauze. And then once that's all completed, I'm going to reposition my patient, make sure that he's comfortable, remove my gloves, all the supplies is disposed of, remove my gloves. Once that's complete, I'm going to document how the patient tolerated the procedure, the size of the catheter that I used, how much urine was flowing in the catheter, and how the patient tolerated it. Thank you.